Are you a baby boomer? Loosely defined, baby boomers are people aged 60 and older. I just turned 60 in July this year, so I'm on the tail end of the baby boomer generation. Or perhaps you're a child of a baby boomer. My son Brad, who you may have seen on these other videos, is obviously one of those people. Something that a majority of baby boomer children, which would be my son, really have talked about is the fact that many are not financially prepared to help their baby boomer parents with higher medical costs, living expenses, and just inflation in general. And something people don't realize that while there are 10,000 baby boomers a day turning age 65, there are about another 10,000 baby boomers that are turning 75. It's estimated that many middle-income baby boomers really have zero savings to cover their retirement care, according to many surveys. So they're going to probably need some help. While children try to help their parents, it can certainly be a burden. Oftentimes, children of baby boomer generations are called the sandwich generation. They had to, again, be like my son, taking care of their own children, but also worried about if their parents are going to need some care. Where does the government step in with all this? And of course, there's some fear in regard to those government programs and how they're very unfunded and accumulating some significant debt. Medicare and health insurance, primarily for many Americans 65 and older, will cover some nursing home and rehabilitation costs, but only for the first 100 days. It may cover some home health care costs, but it really doesn't cover the assistance with the activities of daily living. These are things like eating, bathing, toileting, moving around. People don't realize that it isn't the case and are shocked to find out that those other services that I just described really are out-of-pocket liabilities until you are financially destitute and eligible for the welfare program called Medicaid. So what happens? If you're a baby boomer like me, have you really planned for long-term care? Again, in most cases, we discover here at Action Financial when asking the question that people really have not planned for that. They plan for their retirement, they figure they can cash flow retirement, but really don't think about a long-term catastrophic event that would cause their care needs to have to be facilitated by somebody other than themselves. And really identifying the costs associated with that is confusing. Some tell me they simply don't believe they're going to need long-term care, but the truth is many do. More than 1/3 of people over age 65 will need some type of care for at least 3 years, and 20% of those that need care for even 5 years or more. The lack of preparedness in this is not surprising because long-term care insurance can be very expensive. It's also difficult to get, and people without the financial resources simply have to try to keep this optimistic thought about long-term care and not needing it. A scary way to plan. So what do we suggest? Well, a factor of the problem is that people don't communicate. It's important to talk. If you're one of those sandwich generations like my son, talk to your parents and ask them how they are prepared for any of these catastrophic long-term care needs. And while that's the case, we as baby boomers also have to review that and look at what our responsibility really should be. Meet with a financial services professional to analyze exactly what your options are today and what you could consider. The good news is there's a lot of creativity out there within the state of Wisconsin and the new partnership program. Reach out to us to find out more about this, and if you'd like to have an analysis to look at what those liabilities would be for you and your family.